Have you ever heard of someone's grandma or grandpa breaking a hip after just a small fall? It's not about the bad luck. It could be about the weak bones. Hi, I'm Dr. Motahare, and in today's video, we are diving into the best exercises to strengthen your bones at any age. Whether you are in 30s or 50s or beyond, it's never too early or too late to start building strengths. If you are interested in medical topics explained clearly and accurately, don't forget to subscribe and turn on notification so you never miss a health update. Let's get started. Why our bone strength decreases by aging? In women after menopause, estrogen level drops sharply, which accelerates bone loss. About 1 in 2 women over age 50 will suffer an osteoporosis-related fracture in their lifetime. Bone loss is higher in the first 5 to 7 years after menopause. Interestingly, men also lose bone density with age, which is due to declining testosterone and other factors. Around 1 in 5 men over 50 will experience an osteoporotic fracture. Men account for 25 to 30% of all hip fracture, and they have a higher mortality rate after fracture compared to women. Bone is a dynamic tissue undergoing constant remodeling by bone formation and resorption. Peak bone mass is typically achieved in early adulthood, and thereafter bone resorption may exceed formation, which predispose persons to fragility-related fractures. Physical activities is a modifiable factor influencing bone remodeling via some physical, very complicated pathways, which are called mechanotransduction. Did you know that weight-bearing exercises like walking, squats, or resistance training can actually boost your bone density? It's one of the most powerful ways to fight bone loss as you age. Mechanical loading through weight bearing and resistance exercises generates a strain on your bone matrix, which stimulates bone formation through very complicated pathways. Wolff's law explains how bone adapts structurally to impose mechanical stresses, increasing bone mass and architectural strength. Additionally, resistance exercise enhances muscle strength, which improves skeletal support and reduces falling risk. Balance training also contributes indirectly by preventing falls, which are a major causes of fracture. Meta-analyses confirm that regular impact and resistant exercise increase bone density, especially in lumbar spine and femoral neck. Clinical trials demonstrate up to 1 to 3% annual increase in bone density with constant exercise protocols. Reduced fracture incidence have been also correlated with improved bone density. Effective exercise programs include multi-directional weight-bearing activities like walking, jogging, stair climbing, providing different strain patterns, resistance training targeting major muscle groups with progressive overload to stimulate osteogenesis, and balance exercises like yoga that improve neuromuscular control. ACSM guidelines recommend 30 to 60 minutes per session, 3 to 5 days weekly, tailored to individual capacity and comorbidities. Let's talk about weight-bearing exercises. These exercises require you to support your own body weight through your limb, creating mechanical stress that stimulate osteoblast activity and promote bone formation. Common activities include walking, jogging, dancing, and stair climbing. But always you should take care of your knees, and also wearing supportive shoes. These exercises should be done at least 3 to 5 times a week and at least 30 minutes for each session. Resistance training is the next one. This kind of training uses weights, bands, or your own body weight to build muscle strength, which in turn places a strain on bones, which encouraging remodeling and increasing density. Progressive overload, which means that gradually increasing resistance, is key to stimulate bone growth. Exercises like weightlifting and resistance band workouts are ideal. And finally, my favorite part, balance and flexibility exercises. These exercises, which include yoga, improve proprioception, muscle coordination, and stability. This reduces the risk of falls, which is critical for preventing fractures, especially in older adults or those with low bone density. But always keep in your mind that this should be incorporated regularly alongside strength training. Before initiating exercise, especially in population with low bone density or prior fractures, a medical evaluation is warranted. Proper biomechanics and gradual progression minimize injury risk. Exercises that avoid spinal flexion or high impact torsion are recommended for patients with vertebral fractures or severe osteoporosis. Supervised training with physical therapists can optimize safety and adherence. The current body of evidence underscores exercise as a cornerstone intervention for bone health maintenance and fracture prevention. Integrating weight-bearing, resistance, and balance components yields synergistic benefits. Clinicians should advocate for personalized, sustainable exercise regimens, emphasizing long-term adherence and safety. Thank you all for your attention today. The information I shared is grounded in solid scientific evidence, including comprehensive meta-analysis and peer-reviewed research, to provide you with reliable and accurate insights. If you found this presentation helpful, please consider subscribing to the Art of Medicine from Anatomy to Diagnosis. There you'll find more videos and content breaking down complex medical topics in a clear, evidence-based way. Stay curious, keep learning, and take care of your health.